Understanding Autism Spectrum Disorder. Autism spectrum disorder is a lifelong neurodevelopmental condition marked by difficulties in social interaction and communication, such as limited eye contact, difficulty understanding social cues, and challenges in co-autism spectrum. Restricted and repetitive behaviors, including rigid routines, fixated interests, and unusual responses to sensory stimuli. It varies greatly in presentation, from mild to profound, hence the term spectrum. Diagnosis is typically made based on DSM-5 criteria and observed behaviors, often before age 3. Worldwide, nearly 1 in 100 people, approximately 75 million globally. In USA in 2025, 1 in 31 children. More boys than girls are diagnosed. There is a higher detection rates in high-income countries due to better screening, while in low- and middle-income countries, underdiagnosis remains a major issue. There is no single cause of autism. Instead, it results from a combination of various factors. Genetic factors. Strong genetic component, ASD runs in families. Specific gene mutations, for example, SHANK3, MECP2, TSC1, increase susceptibility. Conditions like Fragile X syndrome and Rett syndrome are linked to ASD. Environmental and prenatal factors. Advanced parental age, especially paternal. Maternal conditions, gestational diabetes, infections, obesity. Premature birth and low birth weight. Exposure to air pollutants or valproic acid during pregnancy. Note that extensive research confirms vaccines do not cause autism. Early identification is crucial. Common signs before age 3 include social delays, no eye contact, doesn't respond to name, lacks interest in people. Communication issues, delayed speech, echolalia, poor use of gestures, for example, pointing. Behavioral patterns, hand flapping, lining up toys, intense fixations. Sensory sensitivities, overreacts to sounds, textures, or lights. Parents should seek developmental screening if multiple signs appear. Early detection improves outcomes. Screening, at 18 and 24 months using tools like MCHAT-R/F. Diagnosis, conducted by specialists using ADOS, ADIR, developmental history, and clinical observation. Global challenge. In low-resource areas, diagnosis is often delayed due to stigma or lack of specialists. Treatment options includes, number 1, behavioral therapies. Applied behavior analysis. Evidence-based, structured teaching using positive reinforcement. Early Start Denver model. Play-based early intervention for toddlers. Pivotal response training. Focuses on motivation and social skills. Number 2, developmental and educational support. Speech therapy. Develops verbal and nonverbal communication. Occupational therapy, OT. Improves daily living and sensory integration. Individualized education programs, IEPs. Tailored education plans in schools. Number 3, medications. Used to manage symptoms like irritability, for example, risperidone, aripiprazole, anxiety, or ADHD, are not the core autism symptoms. Number 4, technological support. Use of apps, communication devices, VR for social training, and AI-based tools to personalize therapy. Certain stressors can intensify autistic symptoms. Sensory overload, bright lights, loud noises. Changes in routine or environment. Lack of communication outlets. Fatigue, illness, or sleep problems. Unrecognized pain or discomfort, for example, GI issues. Managing the environment and understanding individual triggers is essential for stability. Currently, autism cannot be prevented, but some risk reduction strategies include good prenatal care, managing maternal health, avoiding harmful medications, and treating infections. Avoiding environmental toxins, for example, lead air pollution. Early screening in siblings of autistic children to detect early signs. Remember that prevention focuses on reducing risk factors, not eliminating autism, which is increasingly viewed as a form of neurodiversity. Prevalence of autism is based on intellectual ability and language development, access to early intervention, support systems at home and in the community. Some individuals lead independent lives, pursue careers and relationships. Others may need lifelong support, especially if co-occurring conditions, for example, intellectual disability, epilepsy, are present. Mental health. Common co-conditions include anxiety, ADHD, depression, and sleep disorders. Adult and aging autistic populations are increasingly studied to address quality of life and health equity. Creating supportive environments is essential. This includes providing clear and consistent communication, respecting sensory sensitivities, and fostering individual strengths and interests. Early intervention and tailored educational programs can make a significant difference. Top countries offering leading diagnosis, intervention, and support include Sweden, Norway, Iceland, universal healthcare, inclusive education. Canada, public funding for therapy, strong provincial programs. Australia, National Disability Insurance Scheme, NDIS. United Kingdom Autism Act, NHS services. United States, advanced therapies, insurance mandates in many states. These countries focus on early detection, inclusive education, and support for lifelong development. AI and eye tracking tools. Early Point Canvas Dex approved for early diagnosis. Gene therapies. SHANK3 targeted therapy trials launched. Gut microbiome. Research. Microbiome signatures show potential for future diagnosis and treatment. VR and AI coaching. Emerging tools to teach social-emotional skills. Female autism. Research focus on underdiagnosis, camouflaging, and gender-sensitive care. Personalized care models. Subtyping autism for more tailored treatment plans. Numerous resources are available for individuals with autism and their families. Organizations like the Autism Society offer information, support groups, and advocacy. Connecting with these resources can provide valuable guidance and a sense of community. Ultimately, understanding autism is about creating a more inclusive and accepting world for everyone. By educating ourselves, challenging stereotypes, and providing appropriate support, we can empower individuals with autism to thrive and reach their full potential. Let's work together to build a world where everyone is valued and respected.